So now we'll discuss the topic that is the obesity. That's very, very important talk, the obesity. Well, suppose a patient is suffering from obesity. A patient is obese. When you calling the patient obese? When the BMI is more than 25 to 30, we are calling it the overweight. More than 30, obese. Then we'll make some of the grade. Obesity 1, 2, morbid obese. Okay, isn't it? So things are like this. Okay, so whenever we are going to treat a patient with the obesity, there are some sort of ways we can treat the patient with. Like, simply we can go for the conservative management. In Bangladesh, we do usually try this. Okay, so conservative, like the lifestyle modification. Okay, by even with some diet, some gym enrollment or others. Okay, so the lifestyle modification, yeah, there are some of the medical management that's very important, because as you know, currently in Bangladesh, many of the doctors, they're trying. Over there in India, they are trying, and over there in UK is very common. The medications are very common. So yes, the medical treatment, the medical management, and that is a very common talk in Mrcp part 1 and part 2. This is a very common question in Mrcp part 1 and Mrcp part 2. And yes, again, there are some surgical causes. Somehow surgical questions are not asked in Mrcp, but surgical questions from obesity must be asked. Okay, must be asked. Okay, must be asked. So there are some surgical treatment. I mean the surgical options. What are the surgical options? You need to know each and everything from the surgical options. So let us begin that how we are going to treat. So the first thing we're going to talk about the medical management. Okay, so the medical management system, that's the first talk. So now let us see what are the medical management system from this and this. The first medication we need to know about, that is the orlistat or listat. Over there in UK, that is a very popular medication, all you know. That is the orlistat. So we need to know the orlistat. What is orlistat? There is nothing but a pancreatic lipase inhibitor. So as you are using the pancreatic lipase inhibitors, so definitely the patient might be suffering, or patient might develop some sort of malabsorption, isn't it? As this is a pancreatic lipase inhibitor. So loose motion, common finding. So loose bowel, common. Steatorrhea, common. Steatorrhea, again that is a common. Or simply some sort of bowel disturbance, yes, that's also common. Because this is the medication, and that is the business by pancreatic lipase inhibitor. So yes, this findings should be there. Okay, and might be some sort of fecal incontinence, because as you know, bowel disturbances due to the pancreas lipase inhibitor. So the loose bowel, that might be associated with the fecal incontinence. Okay, something like that, the fecal incontinence. Okay, and as this is the loose bowel disturbances, so flatulence. Whenever the pancreas will be impaired, of course, these and these. That's made the common findings for any sort of pancreatic issue, even seen in the chronic pancreatitis, even seen in the cystic fibrosis. Okay, so after giving orlistat, these are the side effects profile. Okay, so after giving the orlistat, so these are the side effects profile. So after giving the orlistat, these are the side effect profile. So what are the next thing we need to know from the orlistat? Now we need to know the indications. When we'll use the orlistat. And always remember, if you are going to use the orlistat, you can use it for only 1 year. Okay, so only 1 year, not more than 1 year. So you will use this less than 1 year, not more than 1 year. Okay, so what are the indications you can use this thing? So the first thing here, what you need to know, if the patient, the BMI, and that is more or equal, that's very, very important, 28 kg per meter square with risk factor. So that's very important, with risk factor. So if the patient is having BMI more than 28 with risk factor, like diabetes mellitus, like hypertension, then you can go for orlistat, otherwise not. What if the patient, the BMI that is more or equal than 30. So no risk factor is needed, you can simply go for orlistat. Okay, so that's the thing, second thing, and remember these questions are asked, so this is very important talk. So what about the third one? Yes, so the third one is that when the patient will be taking orlistat, of course the patient should lose some weight. If the patient is not losing any weight, then you cannot continue the orlistat. So you can only continue the orlistat if there is a history of losing weight. If there is history of losing some weight. If there is history of the losing some sort of the weight. How much? Like they are saying that 5% there is reduction at 3 months interval. Okay, like 5% reduction at 3 months interval, so that is accepted and that is tolerated. Yeah, so it's accepted and that's something, a better news if the patient is taking orlistat for long. Okay, so orlistat BMI 28, BMI 30, and you can continue if there is history of losing weight, minimum 5% in 3 months interval. So the second thing, the second medication we need to know, that is the sibutramine. Sibutramine, again a very important medication. So orlistat and sibutramine, only 2 medication. My recommendations to you guys to know minimum 2 medication. Number 1, that is the orlistat, and second one, that is the sibutramine. Sibutramine is again a very, very important talk on what is that. Anyway, sibutramine, what is sibutramine actually? Sibutramine is nothing but appetite stimulant killer. Okay, so that is a appetite killer. So how it does work? It will actually work on your central nervous CNS. I mean the central CNS. I mean the central nervous system, not the CNS. CNS it does mean the central nervous system. Anyways, it will work on the appetite center. Okay, it will work on your appetite center, and working on the appetite center, it will reduce your appetite. So it's a centrally acting drug. So centrally acting drug. How it is working? Actually, it's working like it's reducing the uptake of serotonin and the norad in the appetite center. Okay, it's reducing the uptake of the serotonin and norad in the uptake center, and somehow it's causing the killing the hunger. Okay, so now what's the problem? Where we are